Hi, my name is Kat. I'm a third-year urology resident at Brigham and Women's in Boston, Massachusetts, and this year I was sponsored through the New England AUA essay policy competition to attend the AUA advocacy conference held in Washington, D.C. This was the first year I've ever gone to the conference, and I actually think it was a great year for a first time because this was the first year since the pandemic started that everyone's been able to get together in person and talk about their ideas and exchange debates on important policy topics. And I think there's just something really magical to be able to do that in person. That's just, honestly, it's hard to replicate over Zoom. And so I felt very privileged to be a part of that atmosphere. There were a couple big topics at the conference this year, including equality in clinical research, asking for more funding for residency training spots, how to incentivize young physicians to work in rural areas, and last but not least, extending the protections around telemedicine. I think one silver lining of an otherwise pretty horrible global health crisis was that, at least in the US, it really let the healthcare system cut through the red tape around insurance and legislation and exponentially normalize telemedicine as a way to deliver care and a way that would not have been possible otherwise. And I think it's something that our patients have really appreciated. At the Brigham, especially given our patients travel from so far away, I think it's been an amazing boon to both clinicians and to patients. At the conference, we got a chance to talk to senators, representatives, and their staffers on how important these issues are to us. And I think it was great to be able to just bring my perspective as a clinician, but also more importantly, my patients' perspectives, and give these politicians like really the ground level story on why these things are important to advocate for. And this advocacy conference, it really did give me the realization that my voice matters, which is maybe something that I hadn't realized before. And it really hit home how, and during these conversations with the staffers, that my stories, my patient stories, these are what drives policy in America. And telling the right story to the right person at the right time can really make a lasting change in the way things happen for the better. And I think that's really important to remember for all of us. Thank you again so much to the AUA advocacy conference organizers for a fantastic conference. I know everyone really enjoyed it. And again, thank you so much to the New England section for sponsoring my attendance. It was very much appreciated, and I learned so much while I was there.